So that's quintessentially, it's an important part that we're still trying to understand is why is a CVT definitely more prevalent in the Southern Asian population. I would say even in Asia, it's Southern Asia probably, which has the registries which are now documenting the evidence that it is growing in incidence and way beyond what is in the rest of the world. So why is this happening? Probably if I can break it down into one vertical, that it is no longer gender specific. In fact, it's become more common in men than women, as against what was reported earlier. It is no longer being relegated just to pregnancy and poor practices of obstetric care, which was earlier said that it is puerperal and, the way they practiced care at that time leading to dehydration, more thrombotic situations, so therefore more CVT. But now we understand it's not even because of increased OCPs or contraceptive use. So it's more in males, more with alcohol use, more in other prothrombotic situations, more with anemia and age factor, which is also shifting towards more older individuals. And then there is this one black box of infections and even the climate and environmental changes which are coming in big way. And there are certain practices, say for example, there are these cultural fasts where you need to fast. So you remain fasting even without water for 24, sometimes to 72 hours. So that those are ritual practices. Say for example, there is Ramadan, okay, for a month-long practice where there are almost 12 hours fasting, and then there are certain Hindu rituals. There is Tej, there is Karwa Chauth. These are the names of the festivals where the women stay fasting. So those are also being one of those contributors. So you do have these peaks happening in summer months during these times, and also the changing climate, environment and pollution. And then you do have other factors which are also growing in incidence. So you do have the NCDs which are growing in or changing in the way the trajectory has been, as against 2 decades earlier to now. You have more NCDs, more non-communicable disorders, which also includes cancer, more prothrombotic situations. So probably a mixture of this that is changing the way the spectrum has been earlier, the same time growing in numbers, and also changing the etiological factors which are contributing to CVT in Asia.